Hello everyone and welcome. Today we're diving deep into Iliotibial Band Syndrome, or ITBS, a common issue for runners and cyclists. You might have heard about ITBS from older sources like Lore of Running, which described it as a friction problem. But medical understanding has evolved significantly since then. In this video, we'll compare those older views with the latest scientific research up to 2024, revealing what we now know about ITBS, its causes, and the most effective treatments. So let's dive into the details of ITBS, starting with what Lore of Running had to say. So what did we think we knew about ITBS back then? In Lore of Running, ITBS was primarily described as a friction problem. The idea was that the iliotibial band, a thick band of tissue running along the outside of your thigh, rubs against the lateral femoral epicondyle, the bony bump on the outside of your knee. This repeated rubbing was thought to cause inflammation and pain. The book also pointed to factors like tight muscles, running on uneven surfaces, and certain foot types as contributing to this friction. Treatment recommendations often included stretching the IT band, using foam rollers, and addressing biomechanical issues with orthotics or shoe changes. But does that older explanation still hold up today? However, our understanding of ITBS has significantly changed in recent years, thanks to extensive research in sports medicine. We now know that ITBS is not simply a friction problem. Instead, it's more accurately described as a compression issue. Studies have shown that the IT band doesn't actually move back and forth significantly over the femoral epicondyle. Instead, it's the underlying fat pad and other tissues that get compressed between the IT band and the bone, especially when the knee is bent at around 30 degrees. This compression leads to irritation and pain. Furthermore, research has identified new risk factors. While muscle tightness and biomechanics still play a role, we now understand that weak hip muscles, particularly the gluteus medius, can contribute significantly to ITBS. When these muscles are weak, it can alter your running form and increase the stress on the IT band. Other factors like rapid increases in training volume, downhill running, and running on cambered roads can also exacerbate ITBS. To get a little more technical, the IT band is not just a simple band of tissue. It's connected to several muscles, including the tensor fasciae latae and the gluteus maximus. This complex interaction means that issues with any of these muscles can affect the tension and behavior of the IT band. With these two perspectives in mind, how do they really compare? To make this clearer, let's compare the old and new understandings of ITBS. You can see that the old model focused on friction and simple mechanical issues, while the new model emphasizes compression, muscle imbalances, and a more complex interplay of anatomical structures. This shift in understanding is crucial because it changes how we approach treatment. Instead of solely focusing on stretching the IT band, we now need to address hip weakness, running form, and other underlying factors. This evolution of knowledge is due to advancements in imaging techniques, biomechanical analysis, and clinical research. We now have a much clearer picture of what's happening at the knee during movement, allowing us to pinpoint the true causes of ITBS. So, what does this all mean for you? Well, it means that managing and preventing ITBS requires a more comprehensive approach than just stretching the IT band. If you're experiencing pain on the outside of your knee, especially during or after running or cycling, it's important to consider the updated understanding of ITBS. Here are some key takeaways. Focus on hip strength. Strengthening your hip abductors, especially the gluteus medius, is crucial. Exercises like side-lying leg raises, clamshells, and banded walks can make a big difference. Analyze your running form. Pay attention to your running mechanics. Are you overstriding? Is your pelvis dropping on one side? Consider getting a gait analysis to identify and correct any issues. Gradual progression. Avoid sudden increases in training volume or intensity. Gradually build up your mileage and intensity to allow your body to adapt. Consider your environment. Be mindful of running on uneven surfaces or cambered roads. If possible, choose flatter, even routes. Don't neglect stretching. While stretching the IT band alone might not solve the problem, maintaining overall flexibility in your hips and legs is still important. Seek professional help. If you're struggling with persistent ITBS, don't hesitate to consult a physical therapist or sports medicine doctor. They can provide a personalized assessment and treatment plan. In summary, ITBS is a complex issue that requires a multifaceted approach. By understanding the latest research and addressing the underlying factors, you can effectively manage and prevent this common injury. Thank you for watching. We hope this video has provided valuable insights into ITBS. If you have any questions or comments, please leave them below. And don't forget to subscribe for more updates on sports medicine and injury prevention.